Introduction. Welcome to this educational video on snoring, focusing on the intricate relationship between craniofacial anatomy and snoring, the process of pharyngeal collapse during sleep, diagnosing and managing snoring in children, nasal obstruction's role, the connection between obesity, snoring, and sleep apnea, different snoring disorders, snoring's link to cardiovascular diseases, surgical interventions, controversies surrounding alternative therapies, genetic factors, impact on pregnancy, and psychological consequences. Let's delve into this complex world of snoring and its implications. Snoring involves noise production during sleep due to soft tissue vibration in the upper airway. The relationship between craniofacial structures and snoring, and the role of anatomical variations in airway obstruction, impact its etiology and severity. Understanding this anatomy helps develop effective treatments. Pharyngeal collapse during sleep can cause snoring and sleep apnea. Understanding the interplay between muscle tone, negative pressure, and anatomical structures helps healthcare professionals develop effective treatment strategies. Snoring in children presents unique challenges when it comes to evaluation and management. Pediatric patients with snoring may experience detrimental effects on their growth, development, behavior, and overall quality of life. It is crucial for medical professionals to recognize the potential impact of snoring in children and consider a multidisciplinary approach to diagnosis and management. Thorough evaluation, involving clinical assessment, diagnostic imaging, and potential referral to specialists, can help identify underlying factors contributing to snoring in children and facilitate targeted interventions. Nasal obstruction is a commonly overlooked factor in the development and severity of snoring. Understanding the clinical implications of nasal obstruction allows healthcare professionals to identify patients at risk and implement appropriate assessment and treatment strategies. Through a thorough evaluation of the nasal cavity, including the assessment of nasal septal deviation, turbinate hypertrophy, and other structural abnormalities, medical professionals can effectively address nasal obstruction and improve nasal airflow, thereby reducing snoring and its associated complications. Snoring and sleep apnea are influenced by obesity through multiple mechanisms, including increased soft tissue mass and altered upper airway dimensions. Understanding these associations allows for tailored interventions that address weight management and upper airway obstruction, leading to better patient outcomes. Simple snoring is merely the tip of the iceberg when it comes to snoring disorders. Upper airway resistance syndrome, UARS, is a clinical syndrome that falls on the spectrum of snoring disorders, beyond simple snoring and before the development of sleep apnea. UARS poses challenges in terms of diagnosis and management, as it may not present with classic nocturnal apneas or hypopneas. A comprehensive assessment, including detailed clinical evaluation, dynamic sleep studies, and identification of predisposing factors, is essential for accurate diagnosis and optimal management of UARS. Recent studies have shed light on the association between snoring and cardiovascular diseases, revealing potential implications for patient management. Snoring has been linked to an increased risk of conditions such as hypertension, stroke, and heart disease. By reviewing the latest research on snoring and its cardiovascular consequences, healthcare professionals can gain insights that aid in risk assessment, prevention, and targeted interventions for patients at risk. Evaluating the effectiveness of surgical interventions for snoring is crucial in determining optimal treatment approaches. Various surgical techniques, including uvulopalatal palatal implants, and radiofrequency ablation, have been employed to address anatomical factors contributing to snoring. By analyzing subjective and objective outcomes, including improvements in snoring severity, sleep quality, and associated comorbidities, medical professionals can make informed decisions regarding the appropriateness and potential benefits of surgical interventions for individual snoring patients. While traditional medical interventions are often employed for snoring management, alternative therapies have gained popularity. Acupuncture, herbal remedies, and positional therapy are among the alternative approaches that patients may consider. It is crucial to critically evaluate the evidence-based efficacy of these therapies while considering potential controversies and contraindications. By understanding the role of alternative therapies in snoring management, healthcare professionals can engage in informed discussions with patients and guide them towards effective and safe treatment options. Exploring genetic factors that contribute to snoring susceptibility opens doors to personalized treatment approaches and deeper insights into the underlying mechanisms of snoring. Genetic markers associated with anatomical variations, muscle function, and inflammatory pathways have been identified as potential contributors to snoring. By understanding the genetic basis of snoring, healthcare professionals can design individualized treatment plans and potentially tailor interventions based on a patient's genetic profile. Snoring during pregnancy can have significant implications for both maternal and fetal health. It is crucial to examine the effects of snoring on maternal health, such as disturbed sleep, gestational hypertension, and gestational diabetes. Additionally, Fetal development may be impacted by reduced oxygen supply, potentially leading to adverse outcomes. Identifying strategies for intervention, such as positional therapy or addressing underlying risk factors, can help ameliorate the effects of snoring on both the mother and baby's well-being. Chronic snoring can have profound psychological impacts on an individual's quality of life and mental health. It is essential to assess the psychological consequences of chronic snoring, including impaired sleep quality, daytime sleepiness, and decreased cognitive function. Implementing interventions, such as cognitive behavioral therapy and relaxation techniques, can address these psychological impacts and improve overall well-being in snoring patients. In conclusion, snoring is a complex condition with implications that go beyond mere noise. Knowledge of anatomy, genetic factors, and psychological effects allows healthcare providers to offer personalized treatment and support, guaranteeing the best outcomes for snoring patients.